Hello, my name's Dan and I'm a physio, band 6 physio, and I've got Kate with me who's a clinical specialist physio. And we've got Stephen here today who's our patient. Stephen's a tetraplegic following a C5 complete spinal cord injury that he suffered in 1986. And what we're going to do today is show you how to perform a manually assisted cough and also how that cough improves peak cough flow. So manually assisted cough is really effective cough in spinal cord injury patients and those with neuromuscular disease. And the idea is that it will compress the abdominal contents to then increase the expiratory forces in the expulsion phase of a cough. It's best performed in sitting upright in a chair, but also can be performed in the bed as well. And the actual action of a manual assisted cough is inwards, up, and then hold. Okay, so we'll measure the peak cough flow first.
So when you're ready, deep breath in and a big cough. Lovely. And that gives us a reading of 180 litres per minute.
Cool. Right, so now I'm going to perform a manually assisted cough. So what I'm going to do is place my hands on the top of his thighs and then my heels into the abdomen around about the pelvic line and then together. Okay. And what we're going to instruct Stephen to do is take a big deep breath in, and then as he's about to cough, I'm going to go in, up, and hold. Okay, you ready, Stephen? Okay. So, when you're ready. Okay. This time we're going to measure the peak cough flow as we do this.
We've got 250 litres per minute that time.
Okay. Great. Thank you.
Thank you.